We have the best doctors that are here from anywhere in the world. And some of the doctors who are here, if you even went to America or even went to UK, you will not get to them. You will have to book for probably 3 or 4 months. But with God's love, they have come here to render their services free because they believe in mankind, they believe in love. Love is probably the best religion we should promote on this earth, the planet. So I really want to thank the whole team. We are very happy, and we have agreed that we will have a long-term partnership with this team so that as a county we can work together, and we shall initiate the process of having a memorandum of understanding.
My name is Helen Nabanjanam Kasa. I'm a professional nurse and social worker. I'm so grateful for this medical camp. We've always seen them give children food, but this time they've brought the medical camp close to us. It has been very successful. I've had an ECG, which is very expensive in Mlogo. I've got medication. I've seen a cardiologist who's a specialist, and he had to examine me. It took time, and there were like 3 surrounding me. So we are very grateful. Please don't forget us. Even if it's after 3 years or 4 years, please come back. We are praying for you. You have a safe journey. It is very successful, very, very successful.
The East Africa Medical Mission was an inspiring and motivational spiritual journey of selfless service, where the medical team of the Sri Sathya Sai International Organization offered consultation, treatment, and free medicine across several specialties, including internal medicine, Pediatrics, Cardiology, Gastroenterology, Gynecology, Neurology, Ophthalmology and Optometry, Anesthesiology, Surgery, Physiotherapy and Rehab Medicine, and Dentistry. A total of 5,605 patients were served in this beautiful service in just 8 days at 6 medical camps across the very same 3 countries in East Africa that were graced by Bhagawan Sri Sathya Sai Baba in 1968: Uganda, Kenya, and Tanzania.
This idea came up last year when we noticed that there are 20 countries in Zone 9 which are under SSIO, and there is a dire need for medication and medical help for these patients. So last year we did camps in Nigeria and Benin, and we noticed the extreme need for help in these countries. And after discussion with our International Medical Committee Chair and our Zone Chair, we decided to have camps in East Africa where there is extreme poverty and people do not have access to basic needs, basic medicines, even proper hygiene as well as nutritious food.
To ensure perfect coordination, a 4-member scouting team arrived a week in advance, tracing the planned routes by road and air to Uganda, Kenya, and Tanzania.
So it was a beautiful journey for all of us. And after reaching Africa, it's like 63 international healthcare professionals, and not only doctors, non-medical volunteers also joined along with us. It's a pilgrimage, truly, but at the same time, we are doing service. So that's the beauty of it. We get into the bus and we start with the prayers and we do bhajans, and the young adults working alongside with the adults and learning a lot of things. That's a beautiful experience. We enjoyed every moment of it.
The first camp was held in Kampala on March 31st at the Sathya Sai Center. The Easter Sunday holiday turned out to be a holy day for the team as hundreds of patients lined up to receive Swami's love. Following the teachings of Swami that service to man is service to God, the healthcare professionals served the patients with the attitude that they were serving their Swami.
I live just around this village, and I came here because I heard that there is a free medical camp, and I came to search for medication. I came here and I met these people, all these doctors. They have helped me. They have given me walking crutches because the one I have was broken, and I'm so glad with them. My body has so many problems, and they are still taking me every step and every room, and I'm so glad in them.
Early next morning, the team travelled for more than 2.5 hours to the Sathya Sai school in Jinja, where more than 800 patients were registered and already seated. They had started arriving as early as 3 am, a reflection of the challenges of catering to the rural and poor population. But this added further fuel to the fire of passion, enthusiasm, and devotion of the medical team. The school staff, along with the school children, were there to lend a helping hand to serve this community. Despite minimal basic facilities of electricity and running water, by the end of the day, the doctors and volunteers had lovingly served more than 1,000 patients.
Today, we are very grateful. We've got different doctors who have cured different diseases to our parents. So it has been a great pleasure today, and all the parents, they have been worked upon. They have gone back home very happy, health-wise. So we thank the three Sathya Sai organization to continue still thinking about our school, three Sathya Sai School, Uganda.
The young adults of the Sri Sathya Sai International Organization supported the event by keeping the school children engaged and entertained.
We just want to start by saying we are so grateful to have this opportunity to volunteer at the medical camp, but especially as young adults, it's been really inspiring seeing all the love and the dedication volunteers have towards everyone at this camp.
Even more astonishing has been seeing how committed these patients are to receiving care. A lot of them wait in lines for hours on end, and some of them even come in at sunrise and leave at sundown. So yeah, I think it just goes to show how underserved some of the populations here are, and we're really grateful to be able to give back to this community.
About 150 patients could not receive medications as it got rather late and dark, and hence arrangements were made to deliver these medicines the next day with the help of a doctor and local health professionals.
My name is Eugene Arusi. I'm a clinical officer. I'm glad to be a participant in this camp, medical camp, whereby I've learned a lot. I've interacted with many doctors, with different qualified doctors, and they are very friendly, and they teach me a lot.
The medical team's arrival at Vihiga County, Kenya couldn't have been at a more opportune time. The government doctors in Kenya had been on strike for several weeks, and the patients were in dire need of medical services. The arrival of the Sri Sathya Sai International Organization's team was a miracle and a gift of Swami's love. The camp served patients on the premises of a church-run mission hospital in Vihiga.
Especially at this moment, I'm very grateful and privileged to host this camp, prepared and organized by Sathya Sai International Organization. This is the first camp and the biggest ever we have held in this facility, and we are very overjoyed for having all the doctors from all over and coming to see our patients, not only seeing them, spreading the love, listening to them, and also giving out the medications. We are grateful to God also for bringing them here, and we continue to pray that God may bless them wherever they go. They continue spreading the love of Christ through the service to humanity.
Despite heavy rains on the first day, The flow of patients did not slow down because the volunteers were drenched in the spirit of love and service.
I'm Dr. Nirupa Shah from Seattle, Washington. I was visiting with my friend Vasi Naika in Australia when she mentioned that she regularly does Sai camps. I told her immediately that I would like to join, and this is how I happen to be here. This is not about one doctor, it's about a team of doctors working together to provide the best possible care that we can to people that would normally not have access to this treatment. So I'm a neurologist, and it has been amazing to see the kind of conditions that people have and how eminently treatable these can be. So for example, I've seen patients in the West. If you see 7 new diagnoses of Parkinson's in a month, that's a lot. I saw 7 in one day.
Touched by the camp's magnanimous service, His Excellency, the Prime Cabinet Secretary of Kenya, and the Honorable Governor of the county visited the camp. They expressed their deep gratitude and great joy to the Sri Sathya Sai International Organization's medical team for this noble mission.
On behalf of the Government of Kenya, particularly the Ministry of Health, and also on behalf of the county government of Kiambu and the area MP of this area, we express our appreciation for this partnership that is bringing everybody together so that those in need of treatment can be treated. The doctors here are from all over the world, a team of 65 doctors, and they're doing a sterling job.
After 1.5 days of service at Vihiga, the team flew to Nairobi for 2 very busy and fulfilling days at the Sri Sathya Sai School in Uthiru, Nairobi. It was a comprehensive team effort with the local Sai devotees and the school staff and children working very hard to make this service a fitting offering to their beloved Lord. The next scheduled campsite in Arusha, Tanzania was set up despite hurdles encountered due to circumstances beyond the team's control at the international borders. The team derived strength and energy from the continuous chanting of God's name, bhajans, and multi-faith prayers by the volunteers during the travel and the short breaks.
Hi, myself Ali. He is my son Muhammad Umar. He was not able to sit with his folded legs on flat surface, but we went to the physiotherapist doctor here in this camp. He made him do a couple of exercises, each for 1 minute. So after that, he is able to sit on flat surfaces very comfortably now, and he told to repeat it for a few weeks so that he will be more comfortable in coming days.
The team overcame sheer exhaustion and provided health care for about 200 patients the same evening, and more than made up for lost time the next day, attending to over 700 patients. The members then traveled 2.5 hours to reach Moshi past midnight for the final day of the camps.
I came with my daughter. Her name is Heaven Light. She was having like sneezing problems and some chest problems. It was very hard for us to, whenever she's sleeping, she couldn't sleep during the night. But yesterday she had some medication from this free medical camp. The good news is that yesterday night, for the first time after a very long time, she had a very nice sleep, and that was a very happy moment for us.
The team was ready in the morning to travel to Mwanga, but the journey to the last campsite was slow, and by the time they arrived, more than 300 to 400 patients had already assembled at the campsite. Again, it was Swami's grace and the team's perseverance that 702 patients received quality medical care filled with love and enthusiasm that day, including written patient care plans in many cases for tertiary hospitals to follow up.
We have a whole team of interpreters that the local team here in Uganda, in Kenya and Tanzania, the local team had organized interpreters for all of us. They helped with giving us food and taking such good care of us. Hats off to the local team here. The patients have been wonderful. We really felt like we made a difference.
One must understand that not all the team members were devotees of Sai Baba, but in the end, they appreciated his philosophy and mission, especially in rendering selfless service.
I've been very privileged that I was invited to this medical camp. It has opened my eyes into learning how other religious groups function and love which is there, and how we can coexist and respect each other's professionalism, and also just we've got the same goal, that is of giving to those that have less than we do. And I feel that that is what the whole Sai group stands for: spreading the love, being kind, being faithful.
As long as we live, so long shall we learn. That is the motto of this team that learns continuously from each medical mission that it undertakes.
The new unique elements for me was that we also had the ability to add technology, simple technology like ultrasound, to drastically alter the way patients had a sense of diagnosis and treatment.
Bhagawan Sri Sathya Sai Baba's only travel outside India was to these 3 countries in East Africa in 1968. The first 2 weeks of April 2024 felt like another divine visit because, beginning on Easter Sunday and concluding on the festival of Eid, the medical service was a continuous outpouring of love for everyone, and it definitely commemorated Swami's historic visit.
And I think having these interactions has been an incredible experience for us, and hopefully for them as well. Seeing us, they've been saying things like, I want to be a midwife, I want to be a nurse, I want to have opportunities that I probably wouldn't have had before. So it's been an incredibly life-changing experience for us getting to be part of this camp. And to watch these women, especially these young women, only one out of all the women we've seen told me, I'm still studying when I asked her about, do you have babies? Only one. So you can imagine how the patients and the community is here. I also want to put in a plug for young adults. As a young adult, this has been an incredibly transformative experience. It's kind of set me up to want to do this work for the rest of my life. So get your feet wet now. As a young adult, come join the camps. Help us out. We have plenty of general volunteers. Even if you're not a healthcare provider, you will be of massive use here, and it will also help you transform